There are two COVID-19 mRNA vaccines available. They are made by Pfizer and Moderna. The Pfizer-BioNTech vaccine is FDA approved for patients aged 16 years and older and under emergency use authorization for other groups. The Moderna mRNA COVID-19 vaccine is authorized for patients aged 18 years and older under emergency use authorization, or EUA.
Patients have the right to accept or refuse the COVID-19 vaccines used under EUA, and there may be an alternative or FDA-approved vaccine for COVID-19 available. There are a few things we must go over to ensure everyone has an understanding of the vaccines and associated benefits and risks.
Disqualifications. If you have any of the following conditions, you should not receive the COVID-19 vaccine. An allergy to any component of the COVID-19 vaccine, which you can find in the vaccine information fact sheet, or if you have received convalescent plasma or any of the monoclonal antibodies for COVID-19 in the past 90 days.
Benefits. The benefit to getting the mRNA vaccine is protection against COVID-19. Both mRNA vaccines demonstrated strong efficacy in preventing COVID-19. This efficacy has been shown to be equal across all races and ethnicities. Both vaccines are a 2-dose series, and it is only after receiving the second dose of the vaccine that you receive the benefit. This benefit occurs about 2 weeks after receiving your second dose. You may need a third dose or booster dose after your initial 2-dose series. You should refer to CDC guidance or ask your doctor when to get an additional dose of vaccine.
Adverse events. Vaccines work by building an immune response. Therefore, if you come in contact with the virus later on, your body will recognize it quickly and be able to fight off infection. Your body has to use a lot of energy in order to build an immune response, so you may notice some adverse effects after receiving a vaccine. Some known adverse events include pain, swelling, and/or redness at the injection site, fatigue, muscle or joint pain, headache, fever, and nausea or vomiting. These may occur 1 to 3 days after vaccination. Most symptoms are mild and get better within 1 day. Acetaminophen, or Tylenol, or ibuprofen, Advil, can be taken to reduce the severity of symptoms post-vaccination unless your doctor suggests otherwise.
If you were to experience a serious adverse reaction, please seek emergency medical care through emergency medical response by calling 911. A rare side effect of the vaccine that may occur is rash and itching around the injection site starting 7 to 8 days after receiving the vaccine. If this occurs, you may apply hydrocortisone cream around the affected area. If the rash persists over 3 to 5 days, contact your doctor. Unknown adverse events are possible. Please report any adverse events to the vSafe app, a CDC-supported platform.
Follow-up. After the vaccine has been administered, please remain in the observation area for 15 minutes. If you have experienced a serious reaction to a vaccine in the past, please let the immunizer know, as you will need to stay in the observation area for 30 minutes. If this is your first vaccination, you will need to return for a second dose at 21 days or 3 weeks for the Pfizer vaccine and 28 days or 4 weeks for the Moderna vaccine after the first dose. You will be scheduled for that dose today. A third dose for people with weakened immune systems should be given at least 28 days after the completion of both doses. A booster dose may be needed after the initial 2-dose series. Refer to CDC guidance or ask your doctor.
If you happen to test positive for COVID in between your first and second dose of the COVID vaccine, please inform your provider. You may receive your second dose if you are no longer in quarantine and are symptom-free.
The individual administering your vaccine will review any questions you may have about the mRNA COVID vaccine and consent you to receive the dose.
The final question we have for you is, do we have your consent to administer the COVID-19 vaccine today?